and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Kathy Sapp. She's joining us here as CEO of the American Chronic Pain Association, and Dr. David Armstrong. He's joining us here as a surgeon and researcher at USC. They're joining us here to discuss nerve damage caused by diabetes called diabetic peripheral neuropathy. They're also going to tell us a bit about an educational campaign called Speak for Your Feet. Welcome to Health Professional Radio, both Kathy Sapp and Dr. David Armstrong. Thank you both for joining us.
Total pleasure to be here.
Thank you. It's a pleasure.
Kathy, I did mention, of course, your role at the American Chronic Pain Association. Give us a brief look into your professional background, and then Dr. Armstrong, if you would do the same.
Okay, so most of my my experience within the healthcare industry was in the pharmaceutical industry, and I provided grants to nonprofit organizations across the U.S. For over 30 years until I joined the nonprofit world, and I was asked to take the helm for a person who started the American Chronic Pain Association 42 years ago. So a year ago I started with them, and it's taken off, and everything is going well. And I'm excited to be able to help those living with chronic pain.
Great.
Yeah, Neil, I'm a podiatric surgeon. I guess you say I'm a toe doctor, a professor of surgery at Keck School of Medicine at USC. I guess I'm a second-generation foot doctor, but my interest is in limb preservation. We run a really big unit here in LA County. And it starts and ends by not just speaking for your feet, but really focusing on this problem, because many of these problems are just eminently preventable.
Well, what can you tell us about diabetic nerve pain and some of the symptoms?
Sure. You'd mentioned there's right now around 37 or so million folks with diabetes around the United States. About half of them are going to develop some sort of peripheral neuropathy. And ultimately, almost all of those will convert to what we call painless neuropathy, but in the beginning, there's neuropathy that can present with all sorts of different constellations of pain, and these are really all over the place. They can range from burning and tingling to feeling like the bed sheets are so painful touching them at night, to feeling like stabbing pain or like bugs are crawling on them, and all these sorts of complications. This can, of course, lead to a whole spiral of problems like insomnia, depression, poor glucose control, further exacerbation of all those problems, and even ultimately getting a wound and that getting infected and leading to amputation. It doesn't have to be that way. That's why we need folks to get in to see their healthcare provider early to try to affect change.
So quite a challenge in simply treating those who have this condition, because it varies so greatly.
It sure does. And that variability and the fact that we're really not presented with it, if you're, say, a medical student or a nursing student, these are not the kinds of things that you ordinarily talk about. I think we're probably really good at dealing with urgent problems, not so good at dealing with these quiet, silent, sinister problems. And that's really what we're talking about right now. And this Speak for Your Feet program is really to try to generate a dialogue between clinicians and their patients, but really focusing on the patient. That's what Kathy's whole organization is really doing.
Kathy, would you say that a lack of education is one of the major challenges when it comes to treating those suffering with this type of pain?
Yes, it is. I think one of the challenges that we see is that it sounds simple, but it's very difficult for people living with pain to describe that to their healthcare professional. And one of the things that we try to do is to give them the tools to go in and speak to their physician and get the care that they need, because they do deserve that. And so we want them to track their symptoms, go in and keep a log of what's going on in their body. So it is very important, and that's why we try to create awareness around the importance of getting in to see your physician.
Kind of take control of your own foot care, as it were.
Correct.
Now, this educational campaign, is that the crux of its?
It is. It's an awareness campaign. And so today what we did is we launched this unique contest, and so that patients can share the symptoms of their condition. Like Dr. Armstrong said, the numbness, the tingling, the pain and the burning. And what we're asking everyone to do is to create a short memory aid, a mnemonic, and describe their pain. And they can enter online at nervepainandme.com/contest.
Yeah, and this is really just a partnership, and this is what it's all about. I mean, I think very often we run into the problem as doctors and nurses and doing things to our patients, and this is really a goal. The goal here is to do something with them, right? And that's the whole "Speak for Your Feet" kind of campaign. And there's so much bad out there that you hear about, but this is just something that's inherently good.
Kathy, in addition to the launch of Speak for Your Feet, talk a bit about the organizations that are involved. It's obviously your organization. Who else is involved in launching this program, and what else is being done to improve the treatment and the lives, quite frankly, of those with diabetic nerve pain?
So this campaign, this contest is unique to the American Chronic Pain Association and Averitas. And what we're doing that coincides along with this contest is we recently launched a diabetic nerve pain toolkit, and this includes resources to really help those patients start that conversation that I talked about earlier. They really need to get in there. They need not to be passive. They need to share what's going on. And it's also important that their caregiver is with them as well and have that conversation with their caregiver. So many times people want to be silent or they're afraid to go in. And so I think that the more educated that the patient is, and Dr. Armstrong, I'm sure that you appreciate it when they come in and they have our tools and they go in there and they've already filled everything out for you. It must make your job so much easier.
It sure does. And I think we used to be, as clinicians, just being kind of the health provider network. I think in the past we were always worried about, Dr. Google or, patients coming in with a whole stack of things on their their phone or their about their condition. But I think forewarned here is forearmed, and I think folks having that information only improves the dialogue. This is a problem that we just have not discussed and described early enough or often enough with our patients, because frankly, it's been like 11th on the 10 most important things to do for some of these patients. But it's not. If we could just bump it up there a little bit, we can really affect change.
Kathy, I heard you mention a website earlier. Once again, could you give our listeners that website where we can learn more about this campaign and about the contest as well?
Yes. So they can enter online at nervepainandme.com/contest. And for the resources for the toolkit is www.theacpa.org.
I appreciate both of you joining us here on Health Professional Radio. It's been a pleasure speaking with you. You've got lots of great information, and good luck with your endeavors and the campaign in the future. Thank you so much.
Thank you. It was a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Kathy Sapp and Dr. David Armstrong. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.